The College of Nurses of Ontario presents the Nurse Practitioner Practice Standard webcast. This webcast is designed to help nurse practitioners, or NPs, also known as registered nurses in the extended class, apply the accountabilities in the Nurse Practitioner Practice Standard, and to help others understand NP practice. This webcast is divided into 6 sections. Each will take approximately 5 minutes to complete. Section 1. Introduction and Scope of Practice. Nurse practitioners are registered nurses in the extended class. They have met the additional nursing education, clinical experience, and exam requirements that build and expand on the entry to practice competencies of the registered nurse. NPs are authorized to diagnose, order and interpret diagnostic and laboratory tests, and prescribe medication and other treatments for patients. NPs practice with diverse patient populations and in a variety of practice settings and locations. All NPs have one or more specialty certificates. This will be covered in the next chapter. The goal of NP practice is the same as all nursing practice, to optimize the health and wellness of clients. The Regulated Health Professions Act, 1991, and the Nursing Act, 1991, set the legal framework for nursing practice in Ontario. The Nursing Scope of Practice Statement, which applies to all nurses, states that the practice of nursing is the promotion of health and the assessment, provision of care, and treatment of health conditions by supportive, preventative, therapeutic, palliative, and rehabilitative means to attain or maintain optimal function. The Nursing Act also identifies the controlled acts that NPs are authorized to perform. In addition to the controlled acts that all nurses can perform, NPs can perform the following controlled acts: communicating to a client or a client's representative a diagnosis made by the NP, prescribing, dispensing, selling, and compounding medication, setting or casting a bone fracture or joint dislocation, and applying and ordering the application of a form of energy. NPs can perform any of these controlled acts without an order or prescription from a physician. Some of these controlled acts have conditions or restrictions on them. Legislation may allow NPs to perform these activities or to order other nurses to perform these activities, depending on their practice setting. For example, the Public Hospitals Act allows NPs who are employees or who have hospital privileges to admit, discharge, and treat hospital patients. In other circumstances, however, it is up to the discretion of the individual organization whether NPs can perform these activities. The law also lists some of the tests and procedures that NPs can order and/or apply. Find an up-to-date list at www.cno.org/NP. This concludes Section 1.